Okay, so we'll discuss a bit about today's session and then we'll continue ahead with the topic today. So, we have seen that artificial intelligence is rapidly transforming in healthcare, but with innovation definitely comes the responsibility. So, in today's session, we'll be discussing that how healthcare leaders understand and adopt AI security with proper ethical and compliance regulatory requirements. So, I'm glad that we all are here and we'll be looking forward towards some informative and interactive session. Coming up to I4, so directly coming up to the topic, I'll be happy to quickly brief what I4 does. We are specialized in next gen AI driven digital solutions with a strong foundation in Microsoft ecosystems along with healthcare. We are cloud solutions partner in Azure and a Power BI certified company, which allows us to deliver scalable, secure, and data driven solutions. As an AI focused agency, we help organizations design and implement AI solutions that are not only innovative but compliant, secure, and business ready. At i4, our services are designed to support organizations throughout their digital transformation journey. Our key services include AI consulting and implementation, data analytics along with their insights, cloud infrastructure and software licensing, at the end, custom software development as well. We operate globally with offices in Australia and US, and our development center is in India, serving clients across multiple industries worldwide. Our experience working with startups, SMEs, and along with enterprises allow us to deliver solutions that are both practical and enterprise grade. It is my pleasure to introduce our speaker for today's session, Charles Hale. Charles is the founder and president of Hale Consulting Solutions and a recognized leader at healthcare IT, cybersecurity, and regulatory compliance, along with AI governance. With over 20 years of experience, Charles has helped healthcare organizations strengthen compliance, enhance security, and improve operational performance. He is a trusted advisor across healthcare, government, and digital health sector. We are excited to have you, Charles, here share your insights on navigating AI, risk in regulating healthcare environment. So, without further delay, let's welcome our speaker today, Charles Hale. Charles, the stage is all yours now.
Thank you so much. That's a very nice introduction. I hope I live up to all of that. And let's go ahead. I will share my screen. We'll start going through the presentation.
Yes, please.
All right. Are you able to see my screen now?
Yes, definitely.
Excellent. All right. Let me first start off by thanking i4 Technolabs for inviting me to do this. And thank you everyone who's attending for spending part of your valuable time here with me today to learn a little bit more about HIPAA compliance and AI use in the healthcare or environment in the healthcare industry. So the reality is that it's no longer if AI is going to be used in healthcare or when AI is being used in healthcare. It is being used in healthcare. It's not the future, it is now. We're really seeing this being implemented in three ways. There's the formal adoption. So there's the organizations that have formally said, we want to use AI, we're going to buy AI-enabled tools, and we're going to implement it into our enterprise. We're seeing a lot of informal adoption. This is probably the most prevalent level of adoption that we see, and that's just people using AI. So I've got a job to do. ChatGPT or Gemini makes my job easier, so I'm going to use ChatGPT or Gemini. No formal governance, no formal approval by the organization. It's just people, basically shadow IT, people using AI to do their jobs. And finally, we're seeing a lot of vendor embedded AI. These are the tools that people have been using for, in many cases, decades. It's your electronic health record, it's your billing service, it's a variety of things that have implemented and embedded AI into their organization or into their software, into their workflows, without necessarily telling anybody they've done so. And we'll explain a little bit about why that can be an issue. To put this into a little bit of context, Fierce Healthcare released a survey recently, and they found that about 80% of the systems out there, healthcare systems, don't have a formal AI governance in place. So that kind of, leads itself to the idea that, there's a lot more informal adoption or ad hoc organic adoption going on than formal governance and formal adoption of AI. So with that, wanted to ask a question, looking into your own organization or into your client's organization, where do you fall in this list? Yes, we formally use AI. We have our AI tools. We have a governance process in place, and life is good. Yes, we know that AI is being used in our organization, but it's more organic. It's more ad hoc. There's no formal governance in place. There's no AI policies in place. And it's being used potentially in a shadow IT form. It's not official IT approved software. It's people are doing what they need to get their job done. And then finally, not that we know of, we don't think our organization is using AI. Reality check, even though most organizations would like to think, yes, we're doing it formally, or no, we're not doing it at all, the vast majority fall into this middle category where they may have some formal AI adoption, but there's a lot more shadow IT going on. And this is a problem when it comes to compliance. But before we start talking about compliance, let's talk a little bit about why is AI being so rapidly adopted in the healthcare environment? And really, we're seeing it being adopted for 4 primary reasons. The first is the workforce shortages. There's not enough healthcare workers and administrative staff out there to do everything that needs to be done. And you can use AI to optimize and improve the productivity of your existing staff. You don't need a nurse on a call line to answer questions. You can implement a chat bot to do that. You may not need somebody double checking the claims or working claims rejections in the back office. You can have an AI that can do that. And so this greatly expands. It's a force multiplier for your workforce. Along with that are the cost pressures. In the United States, the operating margins for a lot of the healthcare organizations is really shrinking. They're getting reimbursed less and they're getting more demand. And so anything you can do, once again, to either reduce your workforce or make them more productive is going to improve your margin. And that is a big differentiator for the healthcare industry. Down here in the corner, the documentation burden. This has been decades that healthcare administration requires a high level of documentation. You need to document, what were your diagnosis? What did the person come in for? What did we do for them? All of this stuff takes time. Some surveys suggest that up to half of a clinician's time can be spent doing documentation. And we've seen various solutions over time, going back to just plain dictation, where someone else takes your notes and the doctor tells them what they did, to now we have AI scribes and ambient tools that do that on their behalf, and cheaper and faster. And finally, working with the cost pressures is the efficiency demands. So we're seeing a massive and workforce shortages. We're seeing longer and longer wait times for people to get in to see their doctors, to see their clinicians. So if the doctor isn't spending half of their time doing documentation, then they can see more patients. They can spend more time with each patient. So all of these things come together to really push the adoption of AI as an optimization, as a productivity tool within the healthcare industry. So what is it being used for? The top thing that's being used for is clinical documentation. That's where we see the highest level of adoption so far. And this is really the AI scribes where you can just record yourself or just talk to it, and it will take the notes, it will format them into the format that's needed for that particular documentation. And, that way you're able to save a lot of time and spend more time doing other activities. If you're a clinician, more time seeing patients. If you're back office, more time working revenue cycle, which leads us into the second category, revenue cycle automation. There is a lot of overhead in the industry associated both on the provider side and the insurance side with revenue cycle, with coding claims, with defining what are the medical codes that are associated that need to go on those claims, with doing pre-authorizations, with doing follow-up. Has our claim been accepted? Was it rejected? Why it was rejected? All of these things require a massive amount of administrative time. And to a large extent, these are being automated through AI. So instead of having a person on the phone trying to track down eligibility to see if a patient has insurance and what their insurance covers, you can have an AI that'll do that automatically. The third one is patient engagement. So this has been an ongoing complaint. Patients feel like I came in and saw the doctor and he spent 5 minutes with me and sent me on my way with a prescription. So AI gives them an opportunity to use virtual assistants and chatbots to ask questions, to say, hey, what are the side effects of this medication? What does it mean that I have this particular condition or diagnosis? And they're able to get a lot more information that way. This has been both a blessing and a curse in the healthcare industry. A blessing in that people are more informed, a curse because, and we'll talk this a little bit later, AI doesn't always give the right answers, and so it's causing some confusion within the industry itself. And we'll talk a little bit about how that we can address that within a governed AI solution. And finally, this is a big up and coming area is in diagnostics and radiology. So we have some amazing diagnosticians, we have some amazing radiologists that are able to look through, your lab results, through your x-rays, through your CT scans, and be able to identify if there's something wrong. AI just takes that to the next level. There's solutions out there now that will do an automatic scan of a x-ray and then pinpoint and say, hey, this doesn't look normal. The radiologist needs to or the doctor needs to take a closer look at this, or look through their lab results and say, hey, everything looks fine, but when you put it all together, there's something kind of off here, and notify the clinician that, hey, this is something to look at further. And that's greatly, has the potential to greatly enhance and improve the efficacy of our medical practice, that people will be able to find more things, that they'll miss less, get more correct diagnosis, and be able to help our patients further. So this is definitely, combined with the shortage we have of radiologists and clinicians, this is definitely an area of focus coming up. So this, I wanted to take just a minute. A few years ago, I called AI a tool. And I was really promoting it as a tool, as, this is the new hammer, this is the new, wrench, this is the new way to get things done better, faster, more in a more optimized method. It has exceeded my expectations. AI is not just a tool, it's actually a shift of our operating model. People just inherently do things differently now with having AI available. So if you're just taking what the old process and enabling it with AI, then you've made the old process faster. But if there was anything wrong with the old process, you didn't fix it. And I think that's what the opportunity that AI is bringing to the healthcare industry is to really redefine how we do some of these things, so that we can make them better, not just faster. So I'm going to talk about HIPAA. I know we've got an international audience, and HIPAA is a US federal law, but most countries in the world have some form of healthcare security and privacy regulations in place. So when I say HIPAA, understand that I really mean security and privacy regulation agnostically. Because I'm based in the United States, HIPAA is the primary thing that we talk about. And HIPAA was written in 1996. The last privacy or security rules that came out of HIPAA were 2014. That was 8 years before ChatGPT. There is nothing in HIPAA about AI. They're doing some final rule updates. We're expecting a new final rule here maybe later this year. But the current rules don't say anything about AI. That said, AI, and OCR has said this in their own guidance, AI is just another process. It still has to comply with all of the same rules as any other technical process under HIPAA. So the privacy rule applies if you're using AI or not. The security rule applies whether you're using AI or not. The breach notification rule applies whether you're using AI or not. Some specific examples around that, HIPAA. So there are very strict rules. HIPAA, sorry, is protected health information. Not everybody lives this every day. But protected health information, there's very strict rules under HIPAA about what you can use protected health information for, how you can disclose it, how you have to use the minimum data necessary to perform a given task. That still holds true even if you're loading it into an AI model. And that has caused some issues we'll talk a little bit about people are just loading, making their entire database, including all the protected health information, available to their AI model or to their AI agent. And you have to then be able to back that up and say, why does it need all of that information? Were you really complying with the minimum necessary rules to be able to do so? Versus selectively deciding what information it needs. Data storage and retention is a big one. So under HIPAA, you're required to not retain your data forever. So you want to be able to purge your data. For Medicare, it's after 7 years, and get that out of the system. If you do retain it, then it becomes a liability issue that anything that you have data for, you're responsible for. AI does a lot of things really, really well. Data retention, well, it's good at retaining the data. Deleting the data is very, very difficult in AI. Once it's in there, it's in there. I was working with a client that it inadvertently loaded some data they didn't want into their AI model. They're like, how do we get rid of it? You purge the model and start over again. That's really, in many cases, the only way to get that data back out of your model once it's been loaded in. So thinking ahead of time about, okay, what data are we loading into our model and what are we going to do with it long term? Is it just going to live forever, or do we have rules and capability to remove that data once it's expired or is no longer useful? And finally, third-party processing. AI tends to be a bit of a black hole that you send your data to a vendor who sends it to another vendor who sends it to an AI model, which is stored in some other location, and then it comes back up the chain. So once you provide data to a vendor, you don't necessarily know what they're doing with it or where it went from there. And under healthcare regulations like HIPAA, that can be a problem because you're still responsible for it, even if you don't know what's happening with it. Yeah, we talked a little bit about this already, that AI is affected by all of the same rules. So you still got the privacy rule, you still got the security rule, you still got the breach notification rule. All of these things apply to AI just like they would with any other system. So the OCR guidance has been very generic at this point. They basically said that HIPAA applies to AI tools that create, receive, maintain, or transmit protected health information. There is no AI-specific exemption. So there's no reason, there's no legal basis to say, because I'm using an AI, I don't have to do this, or the rules are different. No, they're exactly the same. Let's talk a little bit about some of the key risk areas that we've been seeing with AI usage in the healthcare industry. The first one is prompt linkage. Patient data, if the people are putting protected health information into the AI prompts, then that protected health information is in the AI tool. It may be in the logs, it may be in the model, and it can hence be exposed. I think many of us early on in the ChatGPT days had a good laugh when Samsung loaded their code into ChatGPT to have it double check it, and suddenly all of their competitors had access to their new source code. Same thing can happen with protected health information. If you're using a public tool like ChatGPT, like Gemini, they've gotten a lot better, but there's still the possibility that someone else can go and enter a prompt saying, hey, tell me about Charles Hale's medical history. And if it has that information in it because somebody entered it using a prompt, it's possible that that is now public domain. Same thing, training data exposure. So there are organizations, the big thing with AI is how well it's trained. So training data, historical data, has become big money. The problem with that is the same thing. The training data itself, if it's not properly, scrubbed and made anonymous, can be exposed. So if someone gets a massive dump of radiology data from a vendor, so that they can train their new radiology detection tool. If that has protected health information, it may end up in their tool. So you've got a similar issue there with one is prompts that, I'm going in there and just mildly saying, hey, I have a pain on my left side, what could it possibly be? And then someone else has access to that data versus somebody else took my medical data, my electronic health record, and loaded it into their AI tool, and now people have access to that data. The third piece are hallucinations, and hallucinations are, how should we put it? These generative AI models want to give an answer. That's what they are designed to do. And so they look for patterns, and they give an answer, and sometimes the pattern isn't really there, and sometimes the answer isn't really correct. Once again, they've gotten a lot better. A few years ago, this was a big problem. We've seen massive improvement, but there's still instances where it can cause hallucinations. So if a doctor is using AI to say, okay, they have the following symptoms, what do you recommend? The output may not be correct, and it can actually represent a patient safety and liability risk. And this kind of touches back on what we were talking about before about people going in and using ChatGPT and Gemini to do their own diagnosis. You have the same risk on a personal level. It's just amplified and becomes a liability risk when you're doing it at an enterprise level. And finally, vendor misuse. Once again, data is king. And the more data you got, the better your model is trained, and the more accurate it'll be, and the more valuable it is. That said, some AI vendors have taken to training their data, their models on the data that's being entered by their clients. And that may have protected health information in it, and that leads back to our training data exposure issue. So you really need to make sure that your agreement with your AI-enabled entity clearly states that you will not share, sell, or repurpose this data or use it for training. That's the other piece of vendor misuse we've seen is, like I said, this data is very valuable at this point for training models. And so some organizations are now selling their data, and there's a lot of uncomfortableness with that because the AIs are getting good enough that even when you remove the individually identifiable information, they can kind of put it back together again. Oh, okay. It's an individual. He's a white male living in Las Vegas, Nevada, in the northern Nevada area, in the northern Vegas area, and he's approximately 50 some odd years old, and he's got this color hair and these kind of colored eyes. Okay, we've pretty much nailed it down. It's Charles. We know it's Charles at this point, even though it doesn't say Charles. And so that's become a real sticking point in a lot of the AI adoption and the use of real data. Obviously, you want real data to train your models, but making sure that it is de-identified and anonymized in a really solid way. This takes us down to that key insight that most of the AI-related risk under HIPAA or under any type of regulatory thing is really architectural and contractual. It's not malicious. It's not, we could talk about AI and cybersecurity and attackers and defenders and all this stuff, but most of the risk we're actually seeing in the industry right now is really the architectural. How are you using the data? What data are you using? And how are your contracts made with your other vendors that are using AI to make sure that they're using it properly and have structured it properly? All right, let's talk a little bit about some of the most common AI mistakes that we're seeing when it comes to compliance today. First off is public AI tools with PHI. This is happening. This happens on a regular basis, not just in the healthcare industry, in all industries. And that's staff, workers, people entering patient data into a public AI tool. So they're just trying to make their job easier without necessarily thinking, how is that tool secured? Where is that data going? And so it's really a huge no-no under HIPAA or any of the healthcare regulations, but it's still happening. And without a good governance and training and education program, awareness program, this is a tough one to fight. Number two is the business associate agreement. Under HIPAA, if you have a contract with another organization that's doing healthcare related functions on your behalf, whether it's billing, whether it's a therapy, outsourced therapy, anything like that, you need to have a business associate agreement. And a lot of the ones today, even the template that is released by OCR doesn't address AI. So we need to go through and make sure that if you are, preparing an agreement with an AI-enabled vendor, that you address the AI concerns within the contract or the business associate agreement. I want to take a second with this one because this is a really big deal because people are adding AI to their existing tools. So we are seeing a lot of instances where I have been using the same electronic health record vendor for 20 years, same contract, same business associate agreement. I may not even know that they have added AI, enabled AI in their system. And so it really requires a new conversation to go out to your existing vendors, not just new vendors, but the existing vendors, and identify who has enabled AI and which contracts or associate agreements need to be updated to reflect that. Number three, no AI governance structure. No policies, no committees, no direction to the staff and to the organization about what are allowable uses of AI and what you shouldn't use AI for. This is going back to number one. You've got staff that are entering information in ChatGPT and they shouldn't be doing that. Do you have a policy that says they shouldn't be doing that? Have you trained them? Have you told them that they shouldn't be doing that? In a lot of instances, the answer is no. We go back to the Fierce Healthcare survey. 80% of the organizations that they surveyed didn't have an AI governance policy. So they had no way of, well, you should have just known you shouldn't do that. No. You need to tell people what they can and can't do. Shadow AI usage. This goes along with the public AI usage. This is just people adopting AI tools without going through a governance process. So once again, you need a governance process that says, if you're going to use AI, it needs to go through the following process. It needs to be signed off. IT needs to do an evaluation of the vendor. It needs to be signed off by the CIO, whatever your process is. The specific process isn't important. What's important is that you have a process. Number five, this is a killer. HIPAA requires risk analysis and risk analysis, going through your system, identifying the risks within your enterprise that are associated with HIPAA. And it doesn't say on an annual basis. It says that you should do it in a reasonable amount of time. Almost everybody recommends doing it on an annual basis, but we are still using, in many cases, the same risk analysis tools that we have been using for the last 20 years. They need to be updated to account for AI. In many cases, they'll go into an organization and ask for their asset management, their asset inventory, and they don't even have an indicator of what is AI enabled and what's not AI enabled. They don't know. And that's not okay in today's world. You need to know what's AI enabled, and you need to do specific analysis against those tools to make sure that you don't have potential leakage or any other issues associated with that AI. And number six, we talked about the overtrust in AI outputs. The other thing that the generative AI tools are really, really good at is sounding convincing. You get an output from Gemini and it looks good and it makes sense. And if you don't go back and get that validated with a clinician, with a professional, you may be making a big mistake. So we really, we need, as part of the process of, okay, you have a tool, it generated an AI report. Who validated that report before it went into the electronic health record? Who validated that report before the pharmaceutical was ordered? That man in the middle is still critically important. So AI can help do 80%, 90% of the work, but we still need people to validate that other 10, 20% to make sure that we're not making mistakes. All right, the AI risk stack. So this is just, the stack of, the type of risks we have: vendor risks, technical risks, process risks, and user risks. These first two levels, the vendor risk, the technical risk, most enterprises have a really good IT team, they have a really good procurement team, and they do a really good job of this. Things start falling apart when you get into these upper tiers of the pyramid. When you start looking at the processes, not is the AI secure, is the AI, have encryption and all of the things that you would want to see from a technical tool, but how are people using it? What information are they putting into it? Is it appropriate? Do we have the man in the middle validation as it comes out? These are all process level risks. And finally, the user risk, shadow AI prompts, lack of training. This is something that has been a difficulty in our industry for a very long time. How do you control what the users do? And the answer is, except in some extreme cases, you really can't, but you can educate them. You can let them know what's appropriate and what's not appropriate. You can let them know, this is how you should do things. Here's what's allowed. Here's what you'll get in trouble for if we find out you're doing it. Make that, document it, have the policies, have the governance structure, and actually do the training. Don't just put it out on a shared drive someplace and hope people read it. So going into a little bit deeper, these are the 5 pillars of regulatory compliance or HIPAA compliance with AI. The first level is the governance. What is allowable? What do we want to use AI for? What do we not want to use AI for? And how do we want to use it? The second level is the risk assessment. So going through and making it part of your normal risk assessment process to assess the AI tools you have, or if you have AI tools, against that governance, against those policies that you set forth, as well as the regulatory compliance. Number 3, this is vendor management. Is a difficult one because we don't want to micromanage our vendors, but there needs to be a certain level of trust built into your vendor association. That's critical with any vendor relationship, is a certain level of trust. That said, there's an old adage, trust but verify. So go ahead and ask the question on an annual basis. Have you guys done your risk assessment? Did anything fall out of it? Do an annual attestation, just at least some level of due diligence to make sure that your vendors aren't doing things that you don't want them to do with your data. Technical safeguards, this is cybersecurity 101, making sure you have the encryption, making sure that your authentication and access rights are set up correctly. Most of us are pretty good at this level 4. I've been doing this for a long time. It's just making sure that you apply it to your new AI systems as well. And finally, workforce training. I am beating this to death, but it's really, really important that you let people know what the expectations are, what's okay, what's not okay, and that they understand how to use AI in a safe manner. Yeah, and we just kind of walked through this. I got a little ahead of myself here, but yes, the 5 pillars. Okay, this is a personal thing of mine. I think of AI like my brilliant and incredibly naive intern. It requires the same kind of guidance as any other new employee. You need to do a background check. Check your vendor. Is this AI tool, is it, a good one? Does it have a good reputation? Do they have their ISO 27001? Do they have the appropriate certifications that you would be looking for your organization? The job description. You need to define what you're using the AI for. So this goes back to the governance again. Why are we using AI? What do we hope to achieve? That is absolutely important. Otherwise, you just got a really cool looking tool out there that nobody's quite sure why. The employment contract. You need a business associate agreement. We went back to this, making sure that you're holding your vendors accountable and that they are aware as well what those expectations are about how they're using your data and how they are processing, how their AI works. Manager oversight. So the human review process, I've seen this multiple times working with people in the AI thing. I entered a prompt and it didn't work. This sucks. I'm going back to just using Excel. AIs require training. They require human interaction. You need to tell them what's good, what's not so good, and they will get better over time if you do that. Similarly with the hallucination, if you've got somebody checking it and saying, no, you're wrong. This is what really happened. It will learn. It will say, oh, okay, I did this wrong. Let me figure out why I did this wrong, and it'll do better next time. Once again, just like an employee, if you hire somebody and say, prepare my financial report and walk away and give them no further guidance and no further training, they're probably not going to do as good a job. And finally, the HR policies, for a human employee, you have a set of policies about what they can do, what they can't do, what the expectations are. You should have the exact same thing for your AI employees. So you need that AI governance policy of these are approved functions. These are, the tasks that I have approved it for. These are the tools that we've approved for use. And this is what we should not be doing with it. All right, a quick practical use case. We talked about AI clinical documentation and that this is one of the fastest growing areas we're seeing in the healthcare industry is just using it to document, all of the different kinds of documentation that are associated with healthcare, everything from physician notes, pharmacies, discharge notices, all that kind of stuff. And it's a huge time saver, but it also often uses a lot of protected health information and has certain risks associated with it when it comes to HIPAA. So let's talk a little bit about what this can look like done in a compliant manner versus a non-compliant manner. If the doctor or the nurse or whatever is just using ChatGPT to generate their physician notes, not compliant. That's potentially putting protected health information out there where it's readily available to the public. You need a HIPAA compliant vendor and you need a signed business associate agreement to do this properly. By handling, once again, if you're putting PHI directly into a public prompt interface, not compliant. You need to have a model, an interface that is isolated, that the data is only seen by your organization, and that it's encrypted in that environment to keep it safe. Data retention, we talked about this at the very beginning. You put it into ChatGPT and there it lives forever. Many of you may remember when Europe passed the right to be forgotten, and we were always trying to figure out how in the world do you make the internet forget things? AI is 1,000 times worse. It's very difficult to get AI to forget things unless you, from the very beginning, design your model to be able to forget things. And so you want to make sure that you have those contractual data deletion clauses in your associate agreement with your vendor, and they're able to support that. Audit trail. If you're just using ChatGPT, then you've just got your little audit trail on ChatGPT, but there's no logging, there's no record of the AI interactions, and it's getting better, but there's still a bit of a black box element of it gave you an answer and we're not quite sure why it came up with that answer. You want a tool that has a full audit log so you can see exactly what was entered, how it generated its answer and what its final answer was. Human review. We talked about this, just taking the output from ChatGPT and putting it into your electronic health record, probably not a good idea. You need to have somebody, a man in the middle, that can go through those notes and say, yes, this is correct, go ahead and enter it, or no, it's not correct, and then have that feedback loop. I didn't put it in the slide, I should have, but have that feedback loop to tell your AI tool that was not correct and why it was not correct so it can learn and get better. All right, this is kind of a no-brainer, and there we put the answer on the screen, but just kind of an interactive scenario to say, is this compliant? This is a very common scenario, and that's a physician using an AI chatbot on his or her smartphone to draft a discharge summary. They're busy, and it's the same information. It goes in the same format every time. It's the perfect use case for using AI. So she copies the clinical details and she puts it into the prompt, and the tool gives her a nice draft discharge summary, and she puts that into the electronic health record, and everybody's happy. It didn't take an hour. It took all of 5 minutes. Why is that not a good idea? First of all, the PHI disclosure. We're putting protected health information in a non-HIPAA covered tool. That's a privacy violation. No business associate agreement in place. So ChatGPT or Gemini, whoever is absolutely can do whatever they want with that data. There's no agreement. There's no contractual requirements there, and no audit trail. So once again, you may or may not know what was entered, what came out, why it came out. You don't have any trail of the actual transaction itself. So this is just to take a look at your own organization, a real quick compliance self-assessment, and just ask yourself, do you or your clients, do you have a formal AI use policy? Do you have that governance in place? Do you have an AI inventory? Do you have an asset management system or an asset inventory that tells you what software is AI enabled? Have you completed a risk assessment, and did it include AI? So have you specifically looked at what are our AI risks associated with the various solutions within our enterprise? Do you have a signed business associate agreement or contract with your AI vendors? And do you know, going back to the inventory, do you know which of your vendors actually are AI enabled, and make sure that's reflected in the business associate agreement? And finally, have you trained your workforce on AI and HIPAA? HIPAA training is mandatory under HIPAA, so most of us do some sort of HIPAA training within that have a covered entity. But very few of them. I just recently did a training as part of onboarding for a new client, and it didn't even mention AI in the HIPAA training. It was all the basic boilerplate stuff about protected health information that we've been using for the past 15 years. So as you go through these, if you answered no or your clients answer no to more than 2 of these questions, you've got a real risk there. If something happens, and OCR happens to take a look at your organization, they're probably going to say, this isn't right, and they're going to possibly implement a fine and require a corrective action plan for you to fix it. And that's just an area that most of us don't want to get into. All right, it looks like we've got a few minutes left. I'll go ahead and open this up for questions. These are just kind of some questions depending on your role in the organization to ask yourself as we go away. And also I put the QR code and my LinkedIn URL down here. I'd love to continue this conversation with anybody who wants to connect with me on LinkedIn. And so let's go ahead and open it up. Anybody have any questions?
Yeah, I guess we received a message in the chat.
Oh,
Yeah. So gated access to data for AI agents and models seems to be a major challenge in the industry. So is there a leading tool or architecture that is claiming to solve this?
that is a great question, and not that I'm aware of. I think that is a major gap. I think most people are just kind of building what seems reasonable to them, or just not addressing it at all. So I think, Dhaval, you touched on a very important element there about gated access for the AI agents. You know, how do you control what an AI agent has access to or doesn't have access to? Because right now, for the most part, they have access to anything and everything and a lot of stuff you don't even know about.
True that. Coming up to the next question from Dr. Pooja. How can small setups like single specialty clinics implement AI policies without heavy IT infrastructure?
Also a great question. So the AI policies don't have to be something grandiose. Just for your organization, for a small organization, just a very simple policy saying, you know, we use AI as part of our billing, or we use it as part of, you know, we have access to these tools that are AI enabled. And other than that, you know, we allow people to use ChatGPT for non-protected health purposes. It doesn't have to be a 200-page binder. You don't need to implement some fancy software and controls, but you need to be able to, if somebody asks, how do you use AI and what do you use it for, be able to answer that question.
True that. Yeah. Okay. So we have one more question in the line. If a patient app uses HIPAA compliant third-party AI API for clinical triage, but stores patient data in its own database, so does the app need additional HIPAA compliance?
Oh, wow. We're diving deep on this one. Channeling the project manager in me, it depends. If the API does not pass any protected health information, then no. That application, the downstream application, doesn't need to demonstrate HIPAA compliance. That said, we fall into that trap of anonymized data. So you really need to take a really very close look at the data that's being passed through that API to make sure that it can't be used to identify the patient or whoever. But if you're not sending protected health information, then no, the downstream vendor is just providing a non-HIPAA covered service.
Great. So one more question is lined up. We create AI-powered chatbots that can be used for patient management, like handling appointment booking and providing basic symptom guidance. So since we are using an OpenAI model, how can we ensure the patient's data is protected and not exposed or misused?
That's a great question, and I love this use case. I have a doctor I've worked with that implemented a very similar tool, and it made his patients' lives so much better that they were able to make their bookings, and it was intelligent enough to say, okay, this person always takes an hour, so don't book anybody for an hour. You can do some really cool things with this. A great use case. Almost everybody uses some sort of somebody else's model. Very few people develop their own models. How you ensure that patient data is protected and not exposed is having your own private, what they call a tenant. So the data is using their model, but the data itself is isolated and encrypted, and only your version of the model, your instance of the model, has access to that data.
Okay. A couple of more questions are there.
Ma'am,
So, hello.
hello.
Yep.
Yes, please.
Ma'am, one more question then. AI benefits in
Sorry, could you come again? AI benefits in?
gate stance phase.
Will it be comfortable to write in chat if possible, because we are not able to encode it?
Yeah.
Yes, please.
Thank you, Netra.
Yeah.
All right, I see it.
So by that time, we'll cover up the few more questions that we have. So what should organizations check first before allowing AI tools to handle child?
So there are AI questionnaires, vendor questionnaires available out there. There's a whole series of questions you should be sending to your vendor or double checking with the AI. Once again, some of the important things you want to cover: make sure that the protected health information is not being intermingled with public information, that you have a private tenant where this is going to exist only for your organization or for your users. Making sure that it's encrypted, both in transit and at rest. That's just basic HIPAA security 101. It applies to AI just like it does to any other system. Checking and making sure that you have some sort of authentication method, so you know who asked what question and what information they got back, and that they were authorized to do so. So this is really no different than you would for any other application. It's just making sure that you're doing it for AI and that you understand the downstream ramifications as well.
Okay. So next question is, what monitoring tools or strategies are effective for early risk detection or analysis?
So they have been working on an updated version of the security risk assessment that's offered by OCR. That's a good one, and the advantage of that one is because it's produced by OCR, they tend to accept the results of that, when they're doing an audit or doing an evaluation. So I use that with a lot of my clients, but I don't use it by itself. It all comes back to doing your risk assessment. So go out there, look for a good set of tools that are available online, or reach out to us. I can help direct you with that. Connect with me on LinkedIn, and we'll get you a good questionnaire of things to look for when doing a risk assessment for AI tools.
Definitely. Next question from Dr. Hardik. We are performing OCR on patient invoices. So which HIPAA standard do we need to follow as an IT person?
Oh, okay. So optical character. So patient invoices is, I guess it depends. If your invoice has any medical data in it, like the diagnosis codes or the procedure codes or anything like that, then it follows the same standards as any other protected health information under HIPAA. So you'll want to make sure that, once again, the data is not being made public, that it's secured, that you're using the minimum data you need to for the purpose. It follows the standard OCR process as any other protected health information. That said, I've seen organizations that now produce invoices that don't have that information on it. That covers some other issue, because what are you billing me for? But it does free them up from some of the HIPAA obligations.
Okay. So the next question is from Dr. Sara, I guess. the AI in medical field will violate the privacy of field therapists?
Not inherently, no. Just the fact that it's AI, you can do AI in a private and secured way. But you have to have the right controls in place. You have to make sure, once again, you're not using a public tool, that the data, that you have some sort of controls within the AI itself to say, if Charles Hale is inquiring about Netra's, information, don't give it to him. He's not Netra. There's some tricks for getting around that. We can get really deep into this, but basically it follows the same requirements as any, if you have a patient portal, you would expect the same level of privacy and security from an AI tool as you would from a patient portal.
Okay. So next question coming up is, how should healthcare organizations balance the productivity gains of AI tools like clinical subscribes with the risk of over-reliance on AI-generated outputs?
That is a very difficult question and a very personal question. Every organization is going to have a different answer. My answer is that you want to make sure, I am patient first, so we don't want to do anything that potentially puts the patient's security or privacy at risk. That said, there's a wide range of things that you can do without putting it at risk. And always you talk about the over-reliance on AI-generated outputs, having that man in the middle, having somebody to review the AI-generated outputs and validate this is correct. Yes, that removes some of your productivity gains, but in general, it's way quicker to read through somebody else's notes and say, yeah, that's right, than to have to write them up all by yourself.
True that. One last question is, HIPAA was designed before AI existed. So do you believe current HIPAA rules are sufficient, or do we need new regulatory frameworks, especially for AI in healthcare?
Kapil, we had a HIPAA summit last week. This was the topic of discussion in multiple sessions throughout the 4-day summit. I think the general consensus is we need either to update the framework or to generate a new framework to account for AI. One of the big gaps right now is the whole digital healthcare space. So I've got my handy dandy little Aura ring. My Aura ring says what my heart rate is. It says what my temperature is. It does all of these wonderful things, and it sends that off into a cloud, and it's all associated with Charles Hale, and none of that is covered by HIPAA. That's a problem. So
Okay.
it goes beyond just AI. There's a whole lot of things that have, been developed since 1996 that aren't accounted for, and HIPAA needs a major rewrite to account for them.
Okay. Yeah, one more added question from Dr. Pooja. In Indian setup, patients are not very much aware of privacy rights. So how can we create awareness in community? As healthcare management specialist, I would like to associate if any organization works on this.
That is such an insightful and great question, and I don't have a good answer for it. And it's not an Indian thing either. The same thing happens here in the United States. We get a little flyer the first time we go to the doctor that says, here's your rights under HIPAA, and we throw it in the trash can and we move on with our lives. I'm going to put more thought about that. And if you find an answer or organization that's working on this, please let me know, because I think that is a huge gap that, we haven't put enough thought into. Nice.
Okay. Yeah, I guess we haven't received the question from Dr. Netra yet. Okay. Yet not. No worries. If there are certain queries, we definitely can reach out again one-on-one.
Absolutely. And once again, I hope if you can always look me up on LinkedIn or use that URL to connect with me. I'm more than happy to continue the conversation. This has been a delightful session. Thank you again, I4, for making this possible, and everyone for attending.
Yeah, it was truly a precious one for us, delightful for us, because the insights were way more expected.
Thank you.
Yeah, thank you, Charles. It was really informative and insightful session. And special thanks to Himanshi and the team for driving this so well. And thank you everyone for joining and participating in today's webinar. I hope we could provide some useful insights and practical information for your business. And once we are done with the session, we would be sharing a feedback form to everyone. Please share your feedback and input so that we can improvise for our next sessions on the webinar. Thank you once again, everyone. And it was pleasure hosting all of you.
Thank you. Thank you so much. Thank you,
Take care,
everyone.
everyone.
Thank you, everyone.
Thank you.
Thank you. See ya. Bye bye. Good night. Take care.
Thank you.